Very good afternoon to all the participants who are present here. Indeed, it's a great pleasure for me to introduce Dr. Thangamani Ramalingam Alagappan sir, a dedicated senior faculty and physiotherapist with over 25 years of experience. Based in India, he is excellent in patient care, rehabilitation, and pain management. He is recognized for these excellent contributions, including translating Cochrane summarizes and Pedro's homepage into Tamil, publishing over 50 research articles, including Scopus and Web of Science journals, and 4 books with an ISCBN number, and also receiving the Distinguished Service Award from the Indian Association of Physiotherapists in the year 2018. His skill encompasses the patient interaction, standard maintenance, staff training, and connecting research. He has served as a senior physiotherapist and lecturer at School of Physiotherapy in LMS Hospital in Gujarat since 2004. He holds a bachelor degree and master's degree in psychology, postgraduate diploma in research methodology, and current PhD scholar. He is a proficient research assistant in the physiotherapy field and exotically skilled in the data analysis and FPSS software. He is registered with HCPC, MIAP, and then MGPC Gujarat. I'm extremely happy to welcome you, sir, for this session on the topic sample design for our PG students. Over to you, sir. Thank you.
Thank you very much, sir. Thank you very much for your warm and introduction. I think I'm audible to everyone.
Yes, sir.
Yes, okay. Right. If any disturbance in between, please let me know. No. Very good afternoon to one and everyone. Thanks for inviting me and giving me this opportunity to present sample design in physiotherapy research. First of all, research, it's a kind of subject that every one of the different faculties or departments or educational fields, we have to use. Because this is the only way to get into the new and unreached goals of every field. So research and research methodology, it's very important for any profession, irrespective of whichever the stream we are from. In that research, the important concept regarding the sampling and sample size calculation, these kind of things, actually it's a very big constraint for the researchers, as we have some kind of shortcomings or unknown things in terms of numbers and calculating numbers, why we have to do and how we have to do, whether we are doing it right or wrong. These are the important considerations or doubts which always in the mind of the researchers. To make it more simple, this could be considered a hurdle for the research as well. Sampling is nothing but whenever we have to check something in a population of interest. For example, for physiotherapy students, osteoarthritis and knee joint, you would like to see some of the variables and you want to measure those variables before and after an intervention, or how that variables they behave in that particular disease in different times. Like that, there are a lot of research designs we can make. When we make research designs, the designs could be divided into two parts. You can categorize into two. One side, if you see non-experimental or observational designs, the other side experimental design. In the experimental designs and the observational designs, there are a lot of designs or different types of designs there. In general, we can mention that explorative, descriptive, and explanatory. So experimental research design is some kind of study designs which are trying to explain something. It is, if we want to find out the cause, why, that those kind of research designs will come under experimental designs. In that observational designs, we may have to either explore. Explore means something we have to dig into the depth and find out any new variables, whether they are related, how it is, like that. And another one part is that descriptive. Sometimes we may have to describe the scenario in that particular area. And the way I said, for example, the population of interest is osteoarthritis knee joint, OA knee. Why I'm mentioning this particular disease? No, it's a common, and most of the physiotherapists, we know about that. I would like to give you three titles for the same population. For example, I would like to know X treatment. For example, an advanced interferential therapy parameter. Somebody invented a new parameter in the interferential therapy. I would like to know what is the effect of that new interferential therapy parameter in the management of OA-knee. So what I do, I make group of people. I have to select from the OA population. Before that, I will measure the pain. Then I will give the IFT treatment. Then I will measure afterwards the pain. So I will compare before and after the treatment how the pain improved. So I would like to say to the world that I am sure that this interferential parameter, the new parameter which is invented by me or the researcher, is very useful, and it is having significant effect on pain. To say this particular conclusion as a statement to the world, we need a number of sample. It is not possible. For example, in a classroom, you have 40 or 50 students. You take 2 students and you examine them. One fails and one passes the interview or the test which you have kept. So based on this particular thing, you cannot judge the entire 50 students classroom. That 50 classroom is the population. You have selected only 2 people as sample. So what happened? One passed, another one failed. So you are going to conclude to the world that if you keep a test to this class, 50% of the people will fail, 50% of the people will pass. Is it true? It is going to happen? It will not happen. Why? We know that we have taken only 2 people. So this could not be useful to generalize our result. So what result we got? 50% pass, 50% fail. So the same thing is not applicable to the entire population, which is 50. So for the 50 population, how many persons are the participants, are the individuals, are the subjects I have to examine to come to a conclusion? Then that conclusion can be generalized. Because in research, generalizability is the important thing. Whatever you conclude with mathematics or calculations, at the end you have to generalize the conclusion to the entire world. The world will try to follow that. For that, you need a particular number. This is called a sample size. Then, the way I said, you have 50 members in your classroom, you selected 2. How did you select those 2 people as a sample? Whether the sample size is enough or not, that is another one. Already I explained. How did you select these 2 people? Okay, you called them the first number and the last number. This is called a way of convenience. Okay, sometimes no, you may do some purposive calling. One good person. Okay, sir has to test 2 people. Let me take both of them, no, good in studies, like that. These kind of sample selections definitely introduce one word called bias. So this bias will definitely impact the conclusion of your result. So if you take both the people who are good in studies, you have to conclude that both of them passed, so the entire class will pass. So when the result comes, that is not going to happen. The way I said previously, one passed, one failed, you are going to say that half of the class will fail. That is also not going to happen when you get the results. So this is what is important, how you are going to judge the size of the sample and select the sample. Okay, so this selection and all, there are some methods, and those methods are coming under sample design. The way I said, there are a lot of research designs. For each research design, you have to create a sample design accordingly. For example, research design is a survey. You have some kind of methods to calculate sample size and sample design, and you have to make. Okay, that everything depends upon your question, your hypothesis. If it is experimental study, if it is observational study, it is based on your objectives. Okay, these things are going to control your sample design and sample size. This is so there are some kind of basic components of designing a sample. We have to make enough number. If the number is sufficient, then only the result what you produce out of your statistical test, it is going to be valid. So if there is a population of interest, you have to select. So first of all, you should know the population of interest. From the population, then according to the design, you have to decide what kind of sample size and what kind of sampling design according to the entire research design. Each design has got its own what you call attributes. So it is always necessary to understand why to do sample size, sample design. Otherwise, what will happen to research? Okay, to make it little more to you, to make you understand further, if you take research in simply, you can say that there are two kind of things. One is called the confounding, and one is called the bias. This confounding is the factors which are going to be present by default. It is not under the control of the examiner or the researcher or the principal investigator. So we cannot control. It is already there existing in the world. It is called a confounding factor. For example, we have a headache. Somebody, we take some medicine. Some people, we have a coffee. Some people, we don't do anything. We go and sleep. Some people, we keep quiet. Next day, the headache goes. This is called the one who took the medicine. You will think that because of medicine only, my headache got all right. Sometimes even without medicine also, next day the headache goes away. This is called a confounding. Confounding means something is happening naturally in our environment. Okay, inside the body physiology. Because of that, there may be some changes. Those factors are not under our control. These are called confounding. The another one is called bias. Bias is by the experimenter. There are a lot of bias. For example, selection bias of the sample. You conveniently you select your sample. You don't make enough numbers. These are called some kind of mistakes done by the experimenter. Those things are called bias. There are a lot of bias available there according to research design. So to reduce these both of these, this sampling is one of the important things. Okay, so the main purpose of sampling, designing a sample, sampling method, and enough sample size. Okay, I would like to mention you that you can just to overcome the constraints produced by the confounding and bias factors. If the sample design is proper, then only your statistical design also will be proper. Then only you will be having the conclusion validity of your result. Otherwise, that conclusion validity will not be reached, and generalizability of the result, that is not possible when you have flaws in your sampling method and sample size. So this is what is one important concept why we have to make sample design proper, understand different types of sampling, different research designs and different sampling, okay, and how to calculate sample size, how it is calculated, okay. These are the important things which we have to consider in our research. Regarding this, if anyone you have any query, you can just ask me before entering into the slides. Anything you would like to ask? You have any queries?
Sir has talked about the importance of research design and then the confounding factors and the bias part of it. If anybody has got any questions among these things, we can just put a part of it. Otherwise, we will go for the what is in depth of the sample design. Anybody has got any questions? Anybody?
No, sir.
Sir.
Okay, thank you. Yes, sir, we can proceed.
Okay. Okay, right, sir. Can I share the slide?
Yes, sir.
Is it visible?
Yes, sir.
Yes. Okay. The today's objectives are types of sampling, sample size, what kind of errors we are going to make during the sampling, and once we collect the sampling, there is one thing called the sampling distribution. With the sampling distribution only, statistical tests are conducted based on that only. Okay. First, we will see types of sampling. Sampling design. First one, you have two types of sampling design. One is probability, another one is non-probability. Probability sampling is that every one of the population in the population, no, they get the equal chance to represent the sample. So the members of the population, they have the equal chance to participate in the sample. That is called the probability. For example, if I have two groups, I have 4 people. Okay, all the 4 should have the equal chance to either go to experimental or control. Okay, they should not be influenced by any means. It should happen by chance. That is called the probability sampling. The other part is called the non-probability sampling. That sampling, no, we don't have the chance facility or something like that. It is decided based on some other factors. That is called the non-probability sampling. That could be to solve the purpose of the investigator. If you take probability sampling, mostly experimental designs, no, and they have a strong principle of probability sampling. Okay, we are not supposed to do non-probability sampling when we conduct the experimental study design, because when we do experimental study design, if you don't follow the principle of probability in sampling, then that design becomes a quasi-experimental design. So it will not be considered as a what do you call it? True experimental design. You must have studied in research methodology, true experimental design and quasi-experimental design. Non-probability sampling, sometimes some kind of research designs, no, we have to select people purposefully, conveniently, and some cohort, we have to capture them. Okay, for example, we are doing some research in cancer patient. We want only cancer patient. That time, no, we no need to go for probability. We have to go for a non-probability sampling. For example, in survey, in cross-sectional studies, we mostly use non-probability sampling. The next, if you want to read further, you can go to qualitrix.com. Everything is there in that particular site. The next important part in sampling design is that sample size. Already I told about you the sample size, why we do. and what is the advantages of calculating the sample size. Okay, I have kept one article regarding how to use G power and calculate the sample size. And I have kept another one more article also from PubMed. And the third one, sampling error. What are the errors we do while we select our sample from the public? What will happen to the research? Okay. So at the end, in every statistics, you must have studied about standard measure error. Okay. And that will increase if at all we do a lot of errors during the sampling. Sampling distribution, for the sake of understanding chi-square distribution, T distribution, Z distribution, and F distribution. These are all the distributions we have. We have T test, we have F test, that is ANOVA test, we have Z test. Okay, all things you must have studied. According to the type of variable, we use the distributions. For nominal variables, we use chi-square test. For mean comparison or of a scale variable, we use T test. Or proportion comparison, we use Z test. More than two groups are there, you are comparing mean or anything else, you have to use F test. All these things you must have studied. I will explain you what is sampling distribution when it comes to the okay. Sampling methods: probability sampling, simple random sampling, cluster sampling, systematic sampling, stratified sampling. These are the four major probability sampling. Simple random sampling means how we normally do sampling. For example, you want to have 10 people you want to select from your classroom. The classroom consists of 50 people. What do? You make all the 50 cheats. You have to make it lottery, and you have to put it in one container, shake the container, ask someone to come and pick 30. Okay, one by one they will pick. Whoever name or the roll number comes, they will make the sample. Because all the 50, they are numbered, they are kept it in a container, and you are selecting only 30 randomly because no one is looking at the number, it is already hidden. So this is called simple random. But the important aspect of this simple random is that when you want to select apply simple random, you need the whole population before the hand. So you should have the list. If you don't have the list, it is not possible to use simple random sampling. This simple random sampling can be done with random number generator also online, www.randomization.com. There also you can go and you can get it done. Next sampling is that exactly down stratified random sampling. Okay, systemic sampling, cluster sampling. So 4 samplings you remember. Okay, non-probability samplings, convenient sampling, judgmental or purposive sampling, snowball sampling, quota sampling. Okay, this is mostly in qualitative research design or in survey cross-sectional study we use. Okay, one by one I will explain you everything. The way I said, simple random sampling, equal chance of selection, okay, high representativeness, but you need the list of population. Stratified random sampling, it is called stratification. What is stratification? For example, you want to stratify the sample into male and female. It is called stratification. So you need a number of people to represent the male group, and you need some amount of people to represent the female group. This is called a stratified sampling. So each group member, when you select the patient, otherwise what will happen in the research, there will be male and female variation will be there. But if you don't have that interest of comparing the male and female, then you no need to worry about this sampling. But the people, what they do the research, they start the sampling. At the end, they want to compare the male and female. When they make the group, out of the total 50 patients in the group, only 10 will be male, 40 will be female. Then what you do? I cannot, what I can do, patients are like that only. So we compare 40 versus 10. So we compare the mean of 40 females with mean of the 10 males. So that is not the right way of doing a testing. Okay, this if you have the idea, you have the objective of comparing this example male versus female, or high bp versus low bp, diabetes without diabetes, so anything, or obese 1 versus obese 2. So any categorization we do after the data collection, most of the people know they end up with this problem. So if they have the objectives, these kind of objectives of comparing and categorizing the sample into two and comparing. So beforehand only you are supposed to have the stratified sampling in your mind. Okay, but it is very difficult, complex, time consuming, because you have to wait for the population. Okay, then only it is possible. Otherwise, no representatives may not be directly proportional to the population. That is the problem. Next one, systematic sampling. Systematic sampling means it is, for example, nth number. Systematic. For example, if you have 100 people, every third number I am going to take. Then what will happen? 3, 6, 9, 12, 15, like that. Like that you are going to take. But the problem is that there may be hidden pattern. Okay, so sometimes what will happen, from 10 to 20 all will be having very less pain. So what will happen, it may dilute your what do you call popular sample characteristics. So you have to be very careful when to use this particular systematic sampling. Okay, so bias and some kind of hidden patterns in the population may risk your sampling. Cluster sampling, it is a cost effective for large population, easier to administer. For example, cluster means uh, a group of people in one particular area, they will be taken together. All together they will be taken. That is called a cluster. Okay. For example, we are doing a study in Surat. All the 8 to 12 zones of Surat Municipal Corporation or Ahmedabad Municipal Corporation, West Zone, East Zone, like that is there. Okay. For example, if they want to assess the malaria or cholera, how it is present, like that, no. So the above sampling, if you see, that will not be useful. What these people will do, and they will make the divide the zones. There may be 8 or 10 zones, example you take. Okay, they will select any two zones randomly. There you go, and they will be taking one street. Okay, they will not take one member. If at all they are taking, for example, one street number 1, they will take all the people from the street number 1, like that. So you have to do it multiple level, you have to do random, then at the end you have to do the cluster. So it is called multi-level sampling, cluster sampling, like that. So cluster means they have to take the entire people as a bunch, they have to include. This is called a cluster sampling. In agriculture, what is the paddy production of this year, wheat production of this year, this kind of research and all, no, and the data is gathered by cluster sampling. We cannot
Sir,
use simple, random, or any other method.
sir,
Hello.
hello. Sir,
Time
we may
over.
stop now. Yeah, you can go for the next link. Yes, sir. Sir, audio is not coming. Yes, sir.
We are talking about cluster sampling. Then convenience sampling. Convenience sampling is that, for example, if at all we are doing research in our OPD, and we are taking the patients whoever is coming with ONE or back pain, that is called a convenience sampling, because we don't go for the population, or we don't go everywhere in the city. We are sticking to one place and
Hello.
hello,
Yes, yes, sir. Proceed.
hello. Ah, purposive sampling. For example, if I want to know the perceptions or experience of a physiotherapist practicing in Anand, okay, I would like to know what is their perception, opinion about physiotherapy, how patients are there, like that. Then no, I cannot ask one person who started practice yesterday. So I need people practicing in Anand town for a long time. At least I will keep some 10 years experience working only in musculoskeletal OPD and every day working for 8 hours. Okay, a minimum at least 20 patients per day. Like that, I will keep criteria. Those persons only I will take it as a sample. This is called purposive sampling. Then only I will come to know about the practicing issues in physiotherapy, musculoskeletal OPD in Anand. Okay, so it is used in qualitative research, especially like phenomenological studies, grounded theory. There and all we use purposive sampling. Next one is called snowball sampling. Snowball sampling is when we could not able to reach the population, we use the snowball sampling. For example, if at all mostly online survey and all, no, we use that. Sometimes no. For example, we are doing some research with students of physiotherapy. We cannot reach all the students, but what we can do is that from one student we can get the data, and we can tell that student, if you know same kind of characteristic people, then you can share this particular sheet with them and get it filled. So what will happen? One will catch the other one, that one will catch other one, like that, one or two. So it will reach everywhere. This is called a snowball sampling. For example, I am conducting an online survey. I will share the link, Google Form link, with all the principals and staff members of Gujarat. Then I will tell them, wherever you know some colleges there are faculty principals, please share this with them. So what will happen? The entire India I can cover by snowball sampling. Even though I don't have the address of all the colleges from all the states, I cannot connect all the principals and faculties. In that way, we can do that. This is called a snowball sampling. Then quota sampling, it is also same thing, like stratified sampling, but it is in qualitative research mostly they use. Quota sampling means whenever they do who will win in the election, that time not simply randomly they ask some 100,000 people, the results are going to be a failure, because voting has got a lot of things. Okay, different layers of people, different characteristic people, different attributes are there. So if you are taking sample from each and every category, then only, okay, for example, government employees, non-government employees, labor people, business people. So each and everywhere you have to take some kind of samples. Then only the conclusion will be right. Otherwise, what will happen? The way recently happening in India, what will happen? They will predict one, the result will be something else, because they have not taken quota sampling. They have simply randomly taken the sample from the public. That is why, and the poll predictions and all mostly wrong. Okay, so these are all the samplings. If you see the picture, you can understand the first one is random generator. Okay, the computer you can do, or lottery method you can do. Okay, this one is called stratified random sampling. See, third person is being third, six, like that. This is stratified random sampling, stratified as well as systematic also. 1, 3, 4 male, female, 1, 3, 4 male, like that. Okay, this is called cluster sampling, this side. Okay, see, 5, 16, 28. Sector number 5, people living in sector number 5, people living in sector number 16, people living in sector number 28. total sectors 32. So they take all the people and they find out whether any disease is prevalent in this particular area. Like that, we can do that. This last one, this picture is the convenient sampling. Whoever is visible to you, you call them and use them as your participant. This is called the convenient sampling picture. I would like to give a little more weightage to randomization, because most of the physiotherapy students know casually we do experimental study, 2 groups, pre-post study. Normally we keep doing. But the biggest mistake what we do is that we forget about this particular line, randomization. So when you don't do randomization, then it is going to affect your design itself, because it will not be a true experimental design. Simply speaking, you cannot call that particular research as a randomized control trial. So when you have a trial, the trial means you are checking any intervention, giving to one group, you are not giving that intervention to another group. You are taking reading pre, post, follow-up, etc., etc. These kind of studies are called clinical trials. So you have only clinical trial, clinical control trial, randomized clinical control trial. Okay. So what is clinical trial? You are just doing one intervention, before and after only one group is there, that is called a clinical trial. When you have 2 groups, one group you are giving the intervention, another group you are not giving the intervention, that is called a control. So that is that particular trial is called a clinical control trial. Okay. Next one is called randomized clinical control trial. So if you use any probability sampling, then you have selected the participants from the population, and you allocated means you are giving that particular subjects to each and every group, but in a scientific manner. So the way I mentioned before, probability sampling. So you have to do any one of these probability sampling, and then you have to allocate the member in each and every sample. For example, I have 2 groups, experimental group, control group. I have many patients. So what I do, I take the patient number 1, you go to experiment. Patient number 2, you go to control. Patient number 3, you go to experiment. This is not considered as randomization. This is not at all considered as randomization. Okay, odd number, even number, based on the birth date, based on the age grouping, okay, based on the gender, this side, that side, like that, whatever we do, all those things are called non-randomization. It is not considered as a randomization. Okay, it is called a non-randomization. So we have to do randomization. If we forget to randomize, then for the randomization we have to a simple random, stratified random, all those things. Then if you don't allocate the patient accordingly to the group, these are the things going to happen. Eliminate selection bias, balances of confounding variables, enhances internal validity. So what will happen? These 3 things, if we don't achieve, then that particular research will not be considered as randomized control trial, or it cannot be considered as a true experimental design. Even after the data collection, your research is going to be a scrap. Okay, you cannot generalize the results. That is the important thing, because you lost the internal validity of the design. Okay, so you have not controlled the confounding, you have not overcome the selection bias. That is the problem. So definitely everyone, whoever is willing to do experimental design with 2 groups, intervention and no intervention, okay, definitely there should be a control group. There definitely there should be randomization. If you don't follow R and C, then it is not considered as experimental study design, true experimental study design. For that purpose, this randomization is very important. So this is also very important to sample design. Sample size, I have already mentioned you why we are doing all those advantages, disadvantages. These are the important criteria which you have to know. I will mention it very fast. At the end, I will use the G power and I will explain you. You are supposed to know the population size. Sometimes sample size is calculated for a known population size, for unknown population size. So for known population size, the formulas are different. Unknown population size, the formulas are different. So you are supposed to have some idea. For example, if you want to do a research in ONE, you have to know in India what is the percentage of prevalence of ONE, or how many people are suffering that detail you have to collect. If you know, then only you can set your sample size. Then next one, margin of error. What is margin of error? I am going to mention something, but I cannot say the exact. For example, blood pressure is 120/80, we say, but it is wrong. It is not that. No BP will be 120 or 80. It is a range. Okay, so the error range, no, sometimes no, it can be between +1, -1, +2, -2, up to plus or minus 5. Okay, this is called the margin of error. For example, mm, I'm telling so and so party will get 30% of vote sharing, ±3. That means maybe 33% or maybe 27%. Okay, so mean is 30. 27 to 33 is the range. So this particular range should be somewhat meaningful when we are doing research. Okay, if the range is very far away, for example, I'm telling only 27% of the vote the party will gain, but the party is getting only 3% vote, then my judgment and the reality is far away. We could not able to detect that. So our research is not useful. This is called margin of error. So margin of error should be considered, but the main issue is that if the margin of error more, but requires a large sample size to achieve the accuracy. So if you keep the small margin of error, then you are very exact, fine. But if you have a large margin of error, less sample size you need. But if you want to be more exact, more factful, then you need more sample. So smaller margin of errors is always preferable, but moderate we have to maintain in our research. Normally in students research, we prefer ±3 to ±5. 5 is maximum. Mostly people can use ±3. Okay, confidence level. This is the thing that the degree of certainty population parameter lies within the margin of error. That's what. So I have given you the range 27 to 33. 30 is the midpoint. Okay, this range my result will come. How many, if at all I do a sampling, first time I do a sample from the public, I get one result. This party will score 27%. I take another sample. From that result comes 27.5% vote. I take another sample. Like that, if I take some 100 samples, okay, 95 times, if my average that value comes between 27 to 33, then my confidence level is good. That means if I say 100 times, only 5 times I will fail. That is 95% confidence level. In physiotherapy research, we mostly use 95% confidence level. But in drug research and all, they use 99% confidence level, because drugs, no, you know that death and all may happen. So they keep 99% trial. If somebody is doing a research on heart attack, this drug is preventing heart attack, they will be keeping 99 confidence level. So after 100 times, only one time they should fail. 99 times, whatever they mention, that should happen. That exactness is necessary in research. Then variability. Variability is nothing but known as standard deviation. Square standard deviation is called variability. Greater the variability means sample must be larger. If you have less, then less variability is less, you have to use less sample. But variability, if you don't know, so this is a difficulty. That time only we do pilot studies and all, we find out the variability. Okay, based on the variability, we calculate the sample size. Greater the variability, more the variation in the sample, then you need more sample size. Okay, less the variation, you need less sample size. Then the next one is called the effect size. That is an important thing. Simply you remember that it is a magnitude of difference. For example, you are comparing two groups mean of the pain you compare. So group 1, group 2, experimental group, control group. The difference of the group, no, that should be a little bit larger. If the larger, the effect size is more. If the difference is less, then the effect size is small. To find out a small effect, for example, first group pain relief is 7, second group pain relief is 6.9. So difference is 7 minus 6.9, 0.1. It's a very small effect size difference between the groups. At the same time, first group experimental group pain relief 7, control group pain relief 2, 7 minus 2, 5. It is a large difference. Then you need less sample size. So if your difference, that means for students, they have to understand that if you have mean difference more, you need less sample. If your mean difference is very less, you need more sample. That is what you have to understand that. Then the next one is called statistical power. Statistical power is 1 minus beta. Beta is type 2 error. Okay, right? Simply, you know that type 1 and type 2 error, false positive and false negative and false positive error. Okay, right? Type 2 error, 1 minus beta. Beta we allow 20%. So 1 minus beta means 1 minus 20, 0.2 is 0.8 or 80%. So 80% power normally we use in our study. Okay, 80% powers. That means 20% error we allow, type 2 error we allow in your research. Okay, apart from that, already I told you about the confidence level. 95% means alpha will be 0.05. So these are the important criteria you are supposed to know before calculating the sample size. When I use the G power, you will understand that. Okay, next one, sampling error. There are two errors: sampling error, non-sampling error. Okay, if you take, this is the population, the next round is called sampling. So when you do the sampling, you may make some sampling frame error. Already I told you, you can conveniently, for example, you are collecting data from 100 schools are there in one city. You want to collect data from 10 schools. You are measuring the height and weight. So what you can do is that the schools whichever near to your living area, their schools you will keep it. This is called sampling frame error. Okay, you are mostly towards one area, so the other area people may be having different characteristics, living in different socio-economic characteristics that may be different. So definitely your research will be highly biased. This is called a sampling frame error. Then once you keep the sampling frame properly, then you make the sample. In that, chance error, that is what you are supposed to do, randomization. You should not select on your own. So if you don't use that, then chance error happens. Then if you go to the next round, that is called response error. Sometimes you make the people in the group, but they are representing the group, their response will be very poor. It's mostly, it happens in survey and all. We send the form, it reaches, but they don't fill and give it back. So response error. Okay, otherwise sometimes what happens, these people, they don't respond properly, they don't understand, poor response, marking 5555 111 like that. So these kind of things also may happen, so you have to be very careful about a response error. Finally only you get the response. So these many errors are possible in the selection of a sample. Okay, right? Sampling error types, random population selection. That is one error. Okay, under cover the entire population, population size error, wrong population focus, volunteer population. Okay, known persons are involved in the what do you call, data collection. Selection bias. What is selection bias? By the researcher. You don't use any randomization. Simply you select whoever is present at 9 o'clock, you collect data from them. Selection bias. Okay, right? These are all the few errors. Already indirectly or indirectly I explained you. These words you remember. These are the errors you may do during your sampling. If you do anything of this, then definitely RCT you are not going to do. You are going to do only a quasi-experimental study design. Okay, you should not violate any of this. Apart from that, I would like to, yes sir.
I share the another link. We might start in that.
Another one.
This
is getting close, sir.
Yeah.
Okay. Okay.
Yeah.
Okay, the way I said, you have the sampling error in between. Apart from that, you have observation error, non-observation error, systemic error, bias, or chance error. All these error together, you just read this one, you will understand. I have written everything. That makes the standard error in the research. Okay, when you apply a statistical test, when you calculate mean, standard deviation, next column, no, in the software it comes standard error. That error should be somewhat less. Okay, so people should not think that I do all these kind of practical errors, no one knows. No, definitely when it comes to number, that error will be showing that. That is the real beauty of mathematics and numbers. So we think that no one watched me when I did these errors. Okay, if at all we don't do, automatically that standard error, measurement error will be more there. Okay, that makes our research less acceptable by the universe. Okay, so definitely you have to consider this. You have to try to avoid the maximum errors whatever I have written. Okay, then only you will be getting proper outcomes in this one. We have come to the last part of the sample design, that is called the sampling distribution. I will explain you what is sampling distribution. You have taken one group, 50 people. You have taken the height of the participants, 50 people. So 50 serial numbers are there. You add all the height and you divide it by 50, you will get a mean. Okay. And if you apply the sigma x minus x dash, that formula, if you apply, you will get a variability and standard deviation. I think all you may be knowing this. Okay. Then what is that? 50 people in a sample is called a sample distribution. Okay. Then what is YING? Sampling distribution. What I do, I take the data. 50 people only I have in my computer data, but how the statistical test packages are working means it is based on sampling distribution. I have a theory called the central theorem, normality theory, and based on that only every statistics works, most of the statistics, especially in our field. You must have heard about degrees of freedom, n minus 1. How many samples I can make from the sample which I have in my computer? I have 50 people height. So what I can do is that n minus 1, 50 minus 1, 49. I can make 1, 2, 3 like that, 49. I will leave the 50th person. Then in the next sample, I will leave the 49th person. In the next sample, I will leave the 48th person. In the next sample, 40. Like that, I can make 49 samples. Okay, so the first sample of 49, second sample of 49 people, n equal to 49, third 49. So each one will be getting one mean. Okay, we can calculate. Add all the 49 divided by 49. Like that, 49 mean will be there. If you take all these 49 mean and you make the mean of mean, that mean will be almost very close to the population mean which you are interested. You want to judge something in the world. Okay, this sample, from this sample, you are trying to judge the world mean. You understand? Population mean. This is what is research. It may be like philosophy, but this is the way it works. Okay. For that, we have chi-square distribution for nominal variable, categorical variable, for the ordinal data, all those things. No, you have other things like t test, z test, okay, f test. These are all called distributions. So everything is going to work based on the degrees of freedom and how many samples are being derived from that particular data what we collected, and make the means and means of means or means of percent, like that. It is all the things. Okay, like that it works. This is called a sampling distribution. So what you have to understand is that if you have a sample experimental group, 20 people are there, their values are called as sample distribution. Okay, if you make many samples from the sample which you have collected and you take the value, that is the any kind of parameter you calculate, not only mean. Then if you make from those samples, you do something that is called a sampling distribution. Okay, so any time the computer, the software will use sampling distributions. You are taking only one data, but from the data it makes many data. That is what is written here. A sampling distribution is the probability distribution of a given statistics based on a random sample. Okay, it shows how the statistics would vary if you repeatedly took samples from the same population. Understanding the sampling distribution is the fundamental in statistics. Okay, right? From the population directly, I can take 50 different samples. Okay, but what I do, I don't have time and this one. So from my sample, I make different 49 samples because that is also from the same population. In that direction, statistics works. You understand? It is called the mean of mean. So anytime you remember, the mean of mean will be, you take many samples from a population and you calculate the means of all the samples, and you take the mean of those means, average mean, okay, that is larger mean. That mean will be definitely very close to the population parameter. This is what is statistics. So we can calculate everything by a sample. So somehow we have judged the population. This is what we need for the world. That is what is known as sampling distribution. The purpose of sampling distribution is that only. Okay. Right. Okay, I have explained you everything. These are the key concepts of sampling distributions. Okay, that is what I explained you little nicely. For your reading purpose, I have kept it everything here. So the important thing is the normal distribution. So we have the assumption law, normal distribution. Your statistical classes, no, they will teach you the sample should be normally distributed. That's a bell shape, Gaussian curve. Okay, that should be present. If it is not in that way, then we cannot use those tests. Whatever we do here, we have to go for a some other non-normality statistics and all different. Okay, we cannot do those tests here. For example, if you want to do a t-test, definitely your sample should be normally distributed. If it is not there, you have to go for non-parametric test. Okay, like that. So this is the book written by me. You can read this book if you want. All the details will be there in the book also. Now I am going to give you one. Stop sharing. Share screen. Is it visible, sir, now?
Yes, sir.
G power. Okay. Now I have taken
Yes.
t-test. T-test.
No, the screen is not visible.
Screen is not visible.
Mm.
G power screen is not
Just
visible.
take...
1 minute.
Yes, sir.
1 minute.
Yes.
Now it will be visible. Now?
Yes, sir. Yeah.
Now it is visible now, sir.
Yes.
Before going to that, you take one example. We are going to compare two groups, one experimental group, one control group. We have the pre-reading. For example, you take a disability scale we have taken. Patients are back pain patients, RMDQ we have taken. Before also we took the disability reading. After 1 month or 2 months treatment also we are taking the RMDQ, this one. So we have two groups, experimental and control group. Okay, I want to compare the mean. My hypothesis is that the experimental group receiving X treatment is better than the group which is taking Y treatment, like that. Okay, so I take means, difference between independent means, two groups. Okay, if you see this here, there will be tails. You know that single tail, always you have to keep two tail. Two tail means either our treatment can be giving better effect, or it can not give any effect, this side or that side. Okay, right? So you have to keep two tails. Next column, if you row, if you see, effect size is there. Effect size D. Effect size already I explained you. It is the mean difference divided by pooled standard deviation. Okay, right? I will explain you that. Next, if you take alpha probability, that is the confidence level 0.05, that means 95% we have kept. Here it is 5% error allowed. Yes. Then power 1 minus beta. So we have kept 95 here. But for physiotherapy research, you can keep 80, 0.80. allocation ratio n2 by n1, group 1 divided by group 2 or group 2 divided by group 1 is 1. That means both groups are having same sample size. 10 means there also 10, 20 there also 20. Okay, like that. Okay, right. If the effect size is here, if I keep the cursor, you can see that D is 0.2 small, 0.5 medium, 0.8 large. Okay, I don't know. I have taken a scale. Already, that scale, I don't know what is the large effect size. Large effect size means RMDQ. One group disability is out of 180, another group out of 100, 40, 80 minus 40, a large one. So we know that MCID, minimum clinical important difference, like that, something we are supposed to know. You must have studied all those things. For example, on a pain scale 10, at least 2.4 difference should happen. Then only it is considered as a clinical difference. If there is a change of 1 point out of 10 scale, then it is not considered as a pain relief. Like that, each scale will be having some range. If at all we don't know, by default, what we do normally, we don't go for small. Small means what will happen? For example, if you see 0.5 medium, 0.8 large. I don't know whether my effect size is going to be large or small. So I keep 0.5, then I go for a enter. If you enter, you see each group it is asking for 64 people. Total I need 128 sample size. So 64 back pain patients in experimental group, 64 in control group. Now you see if I keep 0.5 in that place, I keep 0.8. I am very damn sure that my experimental group will be far better than control group. Okay, it will be a huge effect size. Okay, I know. Then it is only 26. Can you see the difference? 26, 64. It's a vast difference is there. If at all I keep, I don't know, the effect size may be very small also, like that. If you keep 0.2, that will be 394 per group. Okay, sir, I could not able to judge this because my scales are very new. In the literature, many details are not available. Then I have to go for this assumption. Sir, can we go for this assumption? Yes, you can go for this assumption. But logical assumption should be there. Normally, we go for medium. If at all we are damn sure, we go for a large, this one. Okay, for sample size. Sorry, I don't know, but I want to know what could be the effect size, the difference. Then what you can do is that you can go for a pilot study. Okay, you have to click here, determine. If you click, this window will open. Already I clicked it, that's why it is open. You can see that n equal to n1 equal to n2. You select this, you leave that one. I will tell you later. You are doing the pilot study. Before the intervention for 4 people or 5 people, you are giving the intervention. Before and after you take the data. For control group also, before and after you take the data. Before and after difference you take for this group. Before and after difference of this group also you take. When I take the difference of experimental group, the RMDQ improved 20 points. Okay. In the control group, the RMDQ improved 15 points. Okay. So what I keep, mean group, experimental group, RMDQ, mean was 20 improvement, 20. Control group, 15. Okay. So if you have the mean difference, then you may be having one standard deviation also. Okay. That and all, it is possible. You can calculate. It will come. Okay. When you have the data, you can run this one. You can find out mean standard deviation of both the groups. So here standard deviation I keep for 20 means I keep 2.5. For another group, the standard deviation was 1.5. Okay, this is the way it has come. Then I calculate. Effect size is come here. Then I shift the effect size. Calculate and transfer the effect size to this side. Effect size changed here, 2.4. Now I click enter. Only 4 patients I need per group. Okay, this is the way we have to calculate after doing a pilot study. But is the main problem doing sample size calculation after a pilot study is that 4 patients you must have taken conveniently. Okay, you must have used your main bias there. Whoever is going to get very good relief, let me take them, because normally we believe in that. I'm giving intervention, patient should mention that I'm all right. So what we do, we select patient conveniently with more magnification. We find out which patient will give a better result. Those patients you have taken in control group, what you will do, this patient should not get a good relief, then only my difference will be more. So you must have kept very chronic cases, unyielding cases. Okay, so what will happen, here you get more effect size. Okay, more than 1, 2.4. 2.4 means very huge, this one. That is why this many sample only it has come. So people, they come with pilot study, they ask that, sir, you calculate. I calculate, sir, I calculate the mean standard deviation, I put it inside this side. No, it used to show 1 patient. Then they say, sir, this much only. No, then I no need to do research. No, it is the problem. We have the problem with pilot study. Sometimes blindly we cannot use the pilot study and this assumption, both you have to use. So whichever is comfortable, that you have to use. See to that you don't have any bias during your pilot study, number one. The another point, this calculation is for only one outcome measure. For example, I'm using RMDQ, pain, then patient satisfaction, quality of char. For I'm using, then for each one you have to calculate like that. Then you have to add the samples. That will be your sample size for the, for example, RMDQ, you got 448. Then you calculate for quality of life. In that your effect size comes 0.8. What will happen? Okay, your sample will become 26, 52 plus 8, so 60. Then you calculate for the third variable, you calculate for the fourth outcome measure, then add all the sample size together. Okay, that will be your sample size. So when you do this, it may come to 34, 35, 37, like that. Okay, you may think that how it has come that way. Then after calculating this sample size, you have to keep dropouts. Dropout means when we measure first time, patients are available. After the intervention, suddenly in between, patient may run away from the this one. Okay, may have to quit for some reasons. So few patients may not be available for the post assessment. So what you do, you have to expect that. Normally in experimental study designs, you have to keep 15% to 25% dropout. So my sample size totally for the 4 variables, it has come to 80. 80 means 40-40 in each group. So what I keep for 80 patient total, 20% is how much? You have to keep that. Another 16 patient I have to add. 80 plus 16, 96. 96 divided by 2. So each group there will be 48 patients. Like that, you have to make the sample size. Okay, this is the way you have to calculate the sample size for your study design.
So this software is used only for the intervention studies, or you can do it for the studies also?
For any studies, for example, you have the test, that is sampling distribution, exact test, F test, T test, chi-square test is a test. So all these tests are there. You select something. For example, you see F test. If I calculate 3 groups are there, F test is there. I'm going to do one ANOVA. So these many 3 ANOVAs are there. I'm doing ANOVA repeated measure within ANOVA. Okay. There, if you select, it will come. There also effect size 1. And then I make the this one 80 power. Okay, power 90, 95 you can keep. It is good, but more sample size will come. That's it. Number of groups, I have 3 groups, 2 experimental groups, 1 control group. Number of measurement 4, pre, post 1, post 2, post 3. So total 4. That means 0, 2 months, 6 months, 12 months. I'm calculating, I'm measuring the data. Okay, correlation among 0.5 only you have to keep, non-specific correction 1 only you keep, you exactly you enter. So total sample size 6, because this is because of this effect size. Effect size is 1 means it is beyond this one. For if you see F test, normal effect size will be considered, it's not showing actually, it is 0.1, 0.2, and 0.3. That much only.
Okay.
0.1 is small, 0.2 is medium, 0.3 is large. So I keep 0.3. 0.3 if I keep, you can get these many samples in your 24 people. So 3 groups. Each group 8 people you have to use.
Okay.
Like that. Okay.
So like
Same
this
thing
we
if you
can do it.
what's that?
Like this we can do it for the correlate study also, am I right?
Any study you can do. That is also there. For example, 90% power if you keep, it will become 27. But comparatively,
Okay.
2 groups, 3 groups, no, your sample size will become less.
Mm.
ANOVA designs, no, you have less sample size than t-test designs. For example, if you are doing for correlation, you want to compare the male height versus female height. This is the correlation. T-test correlation point biserial. Okay. You have to take one tire only because your correlation will be 0.7, 0.8 like that. Okay. What I do? Coefficient of determination. Coefficient of determination is nothing but known as R square. R square. It is not R square. If your R is 0.7, 0.7 into 0.7, 0.49. That is 5.
Fine.
Okay. If I calculate, you see you can 0.7 is come. So I shift here. I calculate. That's it. If you are sure that your correlation is going to be more than 0.7, you need only 13 sample size.
Okay.
That is also for 95% of power. If you make it 80, it will be further less.
Okay.
Okay. For example, if your effect size is that is the R value, you are expecting only, say, I don't know, it may be 0.5 only. I'm not half of, I don't know like that. Then 0.5 you keep. That also it will come only 21.
Okay.
This is for core. So you have all these things. There is a G power manual is there. If you no need to know also, there is a manual available, internet free document, Word document. Just download it. Whichever the test you want to do, you go there. These particular slides will be there. You press here, you place this number. Every detail is given there.
Okay.
Only thing is that we should know what is effect size. Effect size means for the mean difference, it is called the D, Cohen's D. For a categorical variable, it is called omega, W. For this and all, it is like either P or Q, it will be there, correlation. Pearson.
Okay.
You understand? Like that. That much only you should know. R is coefficient of correlation. R square is coefficient of determination.
Okay.
If it is in ANOVA, partial eta square. Partial eta square, no, that is called effect size. You run the pilot study data, partial eta square will come. That partial eta square value you put here, you calculate the effect size, you shift it here, it will calculate the sample size. Once you are effect size, always it is better to keep medium to medium, not small or not large. If it is assumption.
Okay.
If it is assumption. If you are damn sure that the difference is going to be very high, I am very perfectly, I have done my pilot study. In that also you take only half. So there must be some assumption, there must be some pilot study and understanding. We should not simply rely on pilot study data alone.
Okay. Fine, sir.
Anytime after you calculate this, you from the above, you protocol for power analysis, you click, this will come, the date, time, everything. You copy this. You can take a printout also, and you can give it to your guide. So this is the way I calculated. If you are calculating different, everything till now, whatever we have done, everything is there. You can calculate all these things, take a printout in a paper, and discuss with the guide which one you want to select. 0.8 power, 0.9 power, 0.95 power, t-test or ESET, which test I have to use. So better you do all the things, you discuss with them, whichever is very much suitable, they will select that sample size you use. That's it.
Fine, sir.
Okay, sir. That one. Another one, for example, better idea is that always whenever you do your research, you make only one or two primary objectives. If you have more than 2-3 outcome measures, make all the outcome measures as secondary outcome measures. You calculate sample size only for your primary outcome measure.
Okay.
For example, I am doing ultrasound, pain, disability, patient satisfaction. But which one is very close to ultrasound is pain. So pain is my primary outcome measure. Secondary outcome measure is patient satisfaction and this one, disability. So you have to calculate a sample size only for the pain. No need to do for the other 2 outcome measures. And one more thing, this sample size is mainly for the statistical objectives. It is not for the study design. So we should not think that any study design may require any kind of sampling. That depends upon what is our objective. For example, even I have a cross-sectional study, my aim is to compare the mean, then I have to go for t-test. If at all I'm going for t-test, accordingly I have to select the sample size. Like that.
Fine, sir. Thank you.
Okay.
Any questions? Any questions from the students to sir?
Anyone? My another this thing is that the G Power is free for Windows. You can download and you can install. It is totally free software. Apart from that, survey and all. Manual is very good. In that, every detail. Yeah. So first of all, you have to find out what is your outcome measure, what do you want to compare. So important thing is that statistics fundamental. Your variable is categorical, ordinal, or numerical. You want to compare categorical to categorical, ordinal to ordinal, nominal to categorical, this, that, like that. That combinations. Based on that, which test, then only we decide the sample size. So sample size will not be calculated.
वो अभी बाकी सर उन लोग पढ़ना बाकी है, so they will learn.
Yeah, that's what I'm telling. It is not for the design. You don't go with the title. For this title, what is the sample size? That will not happen. It will be very much pinpointed to the type of the variable.
Okay. Okay. Thank you, sir. Any questions?
Hello,
from students? Any questions?
No, sir.
Okay. So hope that the session has given some information for you to learn about sample design, how to choose the samples, and how to calculate. So once you explore the process, you'll be able to get more and more. So, and then I think the software is also available. So once we learn in depth of the sample design, calculate the sample size, we are able to understand, as I said, like based upon the objective measures, what we choose, or the objectives, what we decide for our research, I think the sample will be varied from case to case basis. So I think this session was very useful, apart from the breakage of between the sessions. So it is recorded, so we will share the video also to all the people. You can go through that later on whenever you require that. So thank you, sir, for your time and your expertise. Hope we will be utilizing our services in the future also. And once again, thank you for your time, and thanks to all the participants who have involved during this webinar.
Thanks.
Thank you, sir. Thank you all once again for participants.
Thank you all. Have a nice day. Thank you.